And there can also be stimulation of uterine smooth muscles due to the ergot alkaloids. In medieval times, ergot poisoning was also known as St. Anthony's fire, after the saint whose help was sought in relieving the burning pains of vasospastic ischemia. So poisoning of grazing animals is common in many areas because the fungus grows on pasture grasses. And the ergot alkaloids also produce a variety of other CNS and peripheral effects. So for the chemistry and pharmacokinetics, there are two major families for the compounds that incorporate the tetracyclic ergoline nucleus. The ergoline nucleus is the nucleus for the ergot alkaloids. And it is called as tetracyclic because it is composed of 4 rings. As you can see here, the amine alkaloids and the peptide alkaloids. And these are the different substances or compounds for each of the families. The ergot alkaloids are variably absorbed from the GI tract, so it actually depends on the type of substance or compound. The ergotamine, if being given orally, is about 10 times larger than the intramuscular dose, but the speed of absorption and peak blood levels after the oral administration can be improved through the administration with caffeine. So caffeine helps in the absorption of the ergotamine. The amine alkaloids are also absorbed from the rectum and the buccal cavity, and after administration by aerosol inhaler. Absorption through the intramuscular injection is low, but is usually reliable. And there are semi-synthetic analogs like the bromocriptine and the cabergoline that are well absorbed from the GI tract. Ergot alkaloids are also extensively metabolized in the body. These are metabolized through the hydroxylation of the A ring, and the peptide alkaloids are also modified in the peptide moiety. So again, if we're going to the table, so this one is the one being hydroxylized for the amine alkaloids. And for the peptide alkaloids, this peptide moiety, the one that is attached to the ergoline nucleus. Okay, so again, the ergot alkaloids act on several types of receptors. So they can act on the catecholamine receptors as well as the serotonin receptors, because as you can see here, this nucleus is the nucleus for catecholamines. This is known as the phenylethylamine. And as you can see here, we can discern the phenylethylamine nucleus in the ergoline nucleus, which is composed of the A ring of the ergoline nucleus. And in the peptide nucleus, in the peptide alkaloid, we can see that the serotonin, the nucleus for serotonin, which is the indolethylamine, is observed in the A and B ring found in the ergoline nucleus. Hence, they are able to act on the receptors that acts on the catecholamines and serotonin. So their effects would include, they can be agonistic, partially agonist, and antagonistic at the adrenal receptor and the serotonin receptors. They can also act on dopamine receptors as an agonist or partial agonist. So we have here a table below which shows the different ergot alkaloids and their action on the different receptors. So the minus sign means antagonistic effect. For the plus sign, it means agonistic effect. While for the 0, it has no effect. It means it has no effect. So again, the ergot alkaloids here, we have bromocriptine, ergonovine, ergotamine, the LSD, and the methylsergine. Okay. So some members of the ergot family have a high affinity for presynaptic receptors, whereas others are more selective for postjunctional. There's also a powerful stimulant effect on the uterus, which seems to be mostly associated with the agonistic or partial agonistic effect of the ergot alkaloids to the serotonin receptors. So its effect in the central nervous system, so ergot alkaloids acts as powerful hallucinogens, especially this substance, the LSD, the lysergic acid diethylamide. It is a synthetic ergot compound which is used in laboratories as a potent peripheral serotonin antagonist. But there is studies that says that the behavioral effects, the hallucinogenic effect of this LSD is due to the agonistic effect of of the of the ergot alkaloids at the pre-junctional or post-junctional serotonin receptors in the CNS. So because of the dramatic central nervous system effect of the LSD, it has no clinical value, even though there's extensive research for this, because this LSD is also prone to abuse. Dopamine receptors in the CNS play important roles in the extrapyramidal motor control and the regulation of pituitary prolactin release. So of all the available ergot derivatives, we have bromocriptine, cabergoline, and pergolide, which has the highest selectivity for the pituitary dopamine receptors. What these do is they directly suppress prolactin secretion from the pituitary cells by activating the dopamine receptors. They compete for binding to these sites with the dopamine itself and with other dopamine agonists like the apomorphine. And they bind with high affinity and dissociate slowly. In the vascular smooth muscles, ergotamine and similar compounds constrict most vessels in nanomolar concentrations. So vasospasm is prolonged, and the response is partially blocked by the conventional alpha blocking agents. Ergotamine's effect is also associated with the epinephrine reversal and with the blockade of the response to other alpha agonists. So what do you know about the epinephrine reversals, doctors? Okay, so when we talk about epinephrine reversal, it just means that instead of if we are going to administer epinephrine to the patient, right? Instead of having an effect wherein the blood pressure will increase, the blood pressure will decrease instead. The reason for this is when the ergotamine binds to the receptor, it actually acts as an alpha blocker as well. Because oftentimes the epinephrine reversal is an effect when a patient also receives an alpha blocker. So the alpha receptors actually causes the effect to have an increased blood pressure. So if the alpha receptors are being blocked, then the epinephrine has no other choice but to bind to the beta-2 receptor instead, because epinephrine can bind to both alpha and beta receptors. So if they bind to the beta-2 receptors, remember, beta-2 receptors will cause a decrease in blood pressure. So for ergotamine, it dissociates very slowly from the alpha receptor. In other words, it produces very long-lasting agonist and antagonistic effect at this receptor. Although much of the vasoconstriction elicited by ergot alkaloids can be ascribed to partial agonist effects at alpha adrenal receptors, some may be the result of effects at the serotonin. So the vasoconstriction for the ergot alkaloids is not just due to alpha, the agonistic effect to the alpha adrenal receptors, but also to the serotonin receptors. Ergotamine, ergonovine, and methysergide all have partial agonistic effect at serotonin vascular receptors. After overdosage with ergotamine, vasospasm is severe and prolonged because they have high affinity, so they dissociate very slowly. This vasospasm is not easily reversed by alpha antagonists, serotonin antagonists, or the combination of both. Ergotamine is typical of the ergot alkaloids that have a strong vasoconstrictor action.
That was a good. I swear. Alright, oh my god. I swear I saw me. Oh my god. Oh no.
So for the uterine smooth muscles, the stimulant action of the ergot alkaloid on the uterus appears to combine the effects from the alpha serotonin agonists. And the sensitivity of the uterus to the stimulant effect of ergot increases dramatically during pregnancy, perhaps because of the increasing dominance of alpha-1 receptors of the uterus as pregnancy progresses. In other words, the uterus at term is more sensitive to ergot than earlier in pregnancy and is far more sensitive than a non-pregnant patient. In very small doses, ergot preparations can evoke the free contraction and relaxation of the uterus. At higher concentrations, these drugs induce powerful and prolonged contracture. So we have ergonovine, which is more selective than other ergot alkaloids in affecting the uterus, is the agent of choice in obstetric applications of the ergot drugs. However, oxytocin is still preferred, even though the agent of choice is ergonovine. It is still oxytocin that is preferred in most cases. In other smooth muscle organs, in most patients, ergot alkaloids have little or no effect on the bronchial or urinary smooth muscle. For the GI tract, however, it is quite sensitive. In some patients, having low doses of these ergot alkaloids can cause nausea, vomiting, and diarrhea, and it is consistent with the action on the central nervous system emetic center and on the serotonin receptors in the GI tract. Okay, for the migraine, ergot derivatives are highly specific for migraine pain. They are not analgesic, however, for any other condition, so it's just for migraine. Although the triptan drugs are preferred by most clinicians and patients, traditional therapy with ergotamine can also be effective when given during the prodrome of an attack and becomes progressively less effective in the later. So we have ergotamine tartrate that is available for this application. It is often combined with caffeine in order for the faster absorption of the ergotamine.
Ate, didelete ko na ito baka mag-quiz din eh.
I-delete na
Wala ka
lang.
na lang, hindi ka magkikita ng Black Friday. Ha? Black Friday.
Black Friday, what?
Waray?
Wala naman ko niya magbayad.
Waray kang bayad?
Joke. Anyway, so migraine, the vasoconstriction induced by the ergotamine is long-lasting and cumulative when the drug is taken repeatedly, as in a severe migraine attack. So patients must be informed that no more than 6 milligrams of the oral preparation must be taken for each attack and no more than 10 milligrams per week. And for very severe attacks, ergotamine should be given at 0.25 to 0.5 milligrams and can be given IV or IM. We also have dihydroergotamine to be given 0.5 to 1 milligram IV, which is favored by some clinicians for treatment of intractable migraine. Intranasal dihydroergotamine may also be effective. We also have metisergide, which was used for the migraine prophylaxis in the past, but is now withdrawn because of toxicity. For hyperprolactinemia, increased serum levels of the anterior pituitary hormone prolactin are associated with the secreting tumors of the gland. So if there's an increasing serum of prolactin, then it's possible that it's the tumor that is secreting it. And also with the use of centrally acting dopamine antagonists, especially the D2 blocking antipsychotic drugs. And because of the negative feedback effect, hyperprolactinemia is associated with amenorrhea and infertility in women, as well as galactorrhea in both sexes. Rarely, the prolactin surge that occurs around the end of term pregnancy may be associated with heart failure. Because of that, cabergoline has been used to treat the cardiac condition successfully. Because we need to avoid having a prolactin surge after at the end of term pregnancy. Bromocriptine is extremely effective in reducing the high levels of prolactin, which results from pituitary tumors and was also associated with regression of the tumor in some cases. Usual dosage of bromocriptine is 2.5 milligrams 2 to 3 times daily. And cabergoline is also similar to bromocriptine but is more potent. Bromocriptine has also been used in the same dosage to suppress physiological outpatient. However, the cardiovascular toxicity postpartum has been reported, and the use of the substance is discouraged. For postpartum hemorrhage, ergot derivatives should be used only for the control of postpartum uterine bleeding and should not be given before the delivery. Oxytocin is the preferred agent for the control of the postpartum hemorrhage, but if the oxytocin is ineffective to the patient, then we can give the ergonovin malate, which is given intramuscularly at 0.2 milligrams. Usually effective within 1 to 5 minutes and is also less toxic than other ergot derivatives. Given at the time of delivery of the placenta or immediately afterward if the postpartum hemorrhage is great. For the diagnosis of variant angina, ergonovin given IV has been used to produce prompt vasoconstriction during the angiography in order to diagnose the variant angina. Variant angina is also known as the pin's metal angina. And in Europe, what they use is the methyl ergometrine. Do you know what is a variant angina or pin's metal angina? It's not actually the same as the cause for the different angina, the stable and the unstable angina, because in stable and unstable angina, infarction occurs. There's something that is blocking the coronary arteries. However, in variant angina, it is the spasm that causes the pain. So ayun, there's no blockage actually for the variant angina. So ergonovin is being used in order to check if it really is pin's metal or other causes of chest pain. For senile cerebral insufficiency, we have dihydroergotoxin. It is a mixture of dihydroalpha-ergotryptin and 3 similar dihydrogenated peptide, also known as ergoloid mesylates. It has been promoted for many years for the relief of signs of senility and more recently for the treatment of Alzheimer's. However, there is no useful evidence that this drug has significant benefits. For the toxicity and contraindications, the most common toxic effects for the ergot derivatives are the GI disturbances like the diarrhea, nausea, and vomiting. And it is possibly due to the activation of the medullary vomiting center as well as the activation of the serotonin receptor in the GI tract. But since migraine attacks are often associated with the mentioned symptoms, the aura, the classic migraine has these symptoms as its aura or the prodrome. So in other words, if the adverse effect for the ergot alkaloids are still not a contraindication for the use of ergot, since same pa rin naman, same pa rin mong kakaroon ng symptom na ganun. A more dangerous toxic effect usually associated with overdosage of agents like ergotamine and ergonovin is the prolonged vasospasm. And this prolonged vasospasm can result to gangrene and may require amputation. Bowel infarction has also been reported, and because of infarction, it may require resection. Vasospasm caused by ergot is refractory to most vasodilators. Most vasodilators does not work with the vasospasm caused by ergot. But there are some cases that the infusion of large doses of nitrocrucide and nitroglycerin has been successful in alleviating the vasospasm. Chronic therapy with methysergide was associated with connective tissue proliferation in the retroperitoneal space, the pleural cavity, and the endocardial tissue of the heart. These changes occurred insidiously over months and presented as hydronephrosis or a cardiac murmur, and in some cases, valve damage requires surgical replacement. Other toxic effects of the ergot alkaloid will include drowsiness, and in case of the methysergide, it causes occasional instances of central stimulation and hallucination. In fact, methysergide was sometimes used as a substitute for LSD. Contraindications to the use of ergot derivatives consist of the obstructive vascular diseases, especially the symptomatic coronary artery diseases and the collagen diseases. Kaya alam naman, gamitan mo pa ng ergot derivative, magkakakosing vasospasm, barado na nga nga daan ang artery, magvasospasm pa, wala ibang way na umawas nga dugo itong nga artery, which could lead to the death of the tissue. And there is no evidence that ordinary use of ergotamine for migraine is hazardous in pregnancy. And use to deliberately cause abortion is contraindicated because the high doses required often causes dangerous vasoconstriction. So that ends the ergot alkaloids. We're going to proceed with the